Thank you. Hello. So Jo Porter's my name, and I'm the Director of the Collaborative Evaluation and Research Centre. We are not a disaster-specific research centre, but Federation University does pockets of research in disaster, and we're always willing to collaborate. Federation University is a regional university. It has campuses sitting in regional sites going right across the state. So we've got quite a footprint right across the entire state, which is interesting and makes our work diverse, right from the border and through all the way from sort of Wonthaggi, Bensdale and up to the border, and then all the way through to Ballarat, Horsham and Ararat down the other end. We always work in a participatory evaluation and research framework in that locals talking to locals. One of the benefits of Federation University and the staff that we have is that we live, work and raise our children and research in these regions, and we're there for the long term. So we actually work with communities because these are our communities. So always working in partnership to improve lives and transform communities. I thought one of the things that I would do is actually just highlight and remind everybody of the work that we do makes a difference to individuals and small communities. And I just wanted to highlight the bushfires in Far East Gippsland and sort of the size and magnitude of these fires, but in particular up into a very small region and sort of the Mallacoota and up to the border end of Far East Gippsland, where we saw 4 fatalities, 550 homes were damaged or destroyed, and many of which 4 years on, these people are still living in shipping containers. And I think that needs to be remembered, that when we're doing research, and especially in the time of the disaster, post-disaster, and especially longitudinally, these people are still displaced and still haven't actually recovered. Many of these communities had a lot of people transition out of their small communities. So once the fire went through, they went, that's it, we're out of here. And so they removed their families from those areas, relocated. By doing that, many schools closed down because they no longer had the number of students needed or required to fit the criteria to actually have a school. And so those schooling now has gone to online schooling. So there's a ripple effect from a disaster, especially in small communities. I want to highlight this group, Bonang. Bonang community is 350 people in a region. There is no town, there's no pub, there's no post office, there's no infrastructure in this particular area. It is a community hall, and it is the most dynamic group of people that I've ever met. And they are incredibly resilient, and they're also really proactive about saying, we're still here and we're thriving, but we need your help. Now, on paper, sitting in a government building, 350 people don't qualify to get the sort of infrastructure help that this community needs. And in particular, it's like going to a third world country in that they do not have health. You talk to people and they say, I know that if I have a car accident, I'm likely to die. If I'm bitten by a snake, I will not get care before I will die. And this is in Victoria. And I'm always astounded just how that distance and some of these remote areas, and we're still in the state of Victoria. So this group of people were really proactive as saying, we've lost everything. We've had the bushfires go through, we've lost families out of here, and our bush nurse, who is the hub of all of our healthcare, has now been taken away from us. We need health care. And so they wanted help to actually tell that story and to have the empirical evidence so that they could go in to then say, we need assistance and we need a structure and a model for care for this region. And they were able to do that. So some of the research that we did was to go in to actually do a mixed methods approach to talk to those people and to provide that empirical evidence for them. And what I'm really pleased to say about this group is that because of that data, they were able then to fund the bush nurse in this region, which is absolutely essential to the health and wellbeing of the community. One of the big things that I picked up on is, and I'm very interested as we come through and we're developing up the Victorian disaster, is that government agencies are the only ones that recognise or care about borders. There are so many of these people that sit right on the border that actually need to or choose, depending on where they are located, that they choose to go to Victoria Healthcare or over to the border into New South Wales. And we need to be able to cross those barriers too in the work that we're doing. So just a couple of quotes to finish off with, because it's really important that we remember. People don't understand what it's like living way out here and why service providers never come. They don't know how far it is and they don't care. These are people who have had generational living in this area, and they're really, seminal, and they're important to these really remote communities, and we should be able to support them to be able to live in these regions. Thank you very much.
Thank you so much, Jo.